Hi everyone, welcome back. So today I am going to be talking about how massage can help with something called hypermobile Ehlers Danlos Syndrome. So throughout this video I'm going to refer to this as hEDS rather than keep repeating that long title. Basically, this is one of the most common disorders of the connective tissue. And while it doesn't impact on life expectancy, but it can really, impact on quality of life and just everyday normal functioning. And this is because of the musculoskeletal pain and joint instability, that happen as a result. In the absence of specific diagnostic tests, indicators of hEDS will usually include joint hypermobility, family history, musculoskeletal problems such as chronic pain or possibly dislocations, signs of faulty connective tissue throughout the body, and I'll go on to talk about specific symptoms a bit later. So with the numerous complications of hypermobility and even, the presence of hEDS-related musculoskeletal issues, sometimes these even aren't enough to confirm a hEDS diagnosis. So this is why reference to a hypermobility spectrum is becoming a lot more common. And so, this can, range from at the very mild end to maybe someone like myself who has hypermobility in my knees, and a little bit probably around my shoulders, elbows and wrists, but nothing too major that really affects me on a daily basis. But it can go right up to, someone who is having constant dislocations, constant pain, and really unable to even do basic daily activities sometimes. So it's quite a wide spectrum. As far as the causes go, it's one of those conditions where no one is really certain of the exact causes, but certainly some have been suggested. And these include a genetic predisposition through a family member, also a possible mutation of the TNXB gene, which is it inhibits something called the tenascin X protein, and this affects the elastin fibers in the soft tissues. Or it could be due to some sort of defective collagen protein. So there's been a few sort of suggested, causes. Now, as far as the symptoms go, as you can see here, there will be a slight variation in symptoms depending on whether the hypermobility is due to a benign joint hypermobility syndrome, or if it is sort of a hereditary, connective tissue disorder. But, you can see certainly it affects pretty much every area, right from the eyes and ears, down through the chest and back, possible bowel and urinary problems, issues with the skin, a potential for dislocation, clicking joints, fractures, right down to sort of pain and weakness in the lower limbs. And it can affect, a person's stature, and, right down to even foot problems. But I'm going to now talk about the sort of most common symptoms in someone with hEDS. Okay, so the main or sort of most common symptoms that people tend to experience when they actually have something like Ehlers Danlos, which is at the more severe end of the hypermobility spectrum, will include certainly those things we've mentioned: joint hypermobility, chronic musculoskeletal pain, dislocations and subluxations, particularly in the shoulders, the knees, and also the jaw. Curvature of the spine can be a real problem, and degenerative bone disease with early onset arthritis or osteoporosis. Being prone to injury, having a poor sense of body position, which, is probably, certainly contributes to that sort of higher risk of injury. A slightly sort of elastic and very smooth skin that is easily bruised. Sometimes on the more severe end of the scale, something called acrocyanosis, which is where the skin, particularly around the hands and the feet and the face, take on kind of a mottled blue colour. And, just general fatigue is a real problem. There are also some what we call associated symptoms. So these are symptoms that are not a direct result of the joint hypermobility, and they're not, a diagnostic factor, but they have been linked to those with hEDS. So these will be things like cardiovascular issues, such as maybe a mitral valve prolapse, aortic root dilatation, or orthostatic tachycardia, which is where you feel sort of dizzy upon standing up from lying down. Can also be called postural hypertension. Also digestive disorders, dysmotility, bloating, nausea, constipation, vomiting, heartburn, sometimes hiatus hernias, all, have been linked again. Pelvic and bladder dysfunction, so it could be things like pelvic prolapse, dysmenorrhea, painful intercourse. Also, there's thought to be a higher risk of complications during pregnancy. So things like premature rupture of the membranes, rapid labour and delivery, and by that we're talking sort of less than 4 hours. Which I'm sure a lot of women out there would think that was like fantastic to have a labour, that quick. But actually, it can be quite risky. And then, also associated symptoms are anxiety, depression, sleeping problems, dysfunction of the autonomic nervous system. So, quite a few issues there. So, in terms of diagnosis, as we've said, there's no specific test to diagnose hEDS. So it usually is dependent on 3 criteria. So I'll explain this as simply as I can, and hopefully I won't confuse you. So the 3 criteria are, number 1, generalized joint hypermobility will be assessed according to something called the Baton score system. And obviously, depending on what score you get on this, will, depend on whether or not it's seen as a possible, factor in diagnosing. Then there has to be, so this is number 2, there has to be 2 or more of the following groups must be present. Okay, so when I say 2 or more of the following groups, okay, we've got 3 groups here. Okay, so at least 2 of these groups have to be present. So the first group is that at least 5 of the following systemic manifestations of a more generalized connective tissue disorder should be present. So at least 5 of these things. So we're talking unusually soft, smooth skin, mild skin hyperextensibility, so when you can kind of pull the skin up and it's almost like you've got a lot of loose skin. Atrophic scarring, which involves at least 2 sites. So by this we mean without the what's known as papyraceous, so like paper thin scars that are seen in classical Ehlers Danlos. So we're talking atrophic scarring on, without those paper thin scars. Or bilateral piezogenetic, which is like skin coloured papules on the heel. And these occur where the fat can herniate through the dermis. Unexplained like red stretch marks, usually around the back, the groin, the thighs, the breasts, and or the abdomen. And also dental crowding with a high or narrow palate. Okay, so other things would be recurrent abdominal hernias, pelvic floor or rectal or uterine prolapse, but we're talking in children, men, or women who've never had children. Arachnodactyly, which is basically abnormally long and slender fingers. And when we say abnormally long, we mean in comparison to, the palm of the hand and the arch of the foot. An arm span to height ratio of greater than 1.05 on the measurement scale. Mitral valve prolapse, aortic root dilatation. So all this long list, there has to be at least 5 of these things. Then, so going back to where we need 2 of the groups to be present, the second group is a positive family history. So we're talking more than 1 first-degree relative diagnosed with hEDS. And then the third group, of which you need at least 2, is that you have at least 1 of the following musculoskeletal complications. So it could be chronic widespread pain for more than 3 months, daily musculoskeletal pain in 2 or more limbs for at least 3 months, or recurring joint dislocations or joint instability at 2 or more sites. So at least one of those. And then on top of having two of those 3 groups present, you must also have all of the following. So an absence of unusual skin fragility, no other inherited or acquired connective tissue disease, no autoimmune rheumatological conditions, and no alternative diagnosis that could explain joint hypermobility as a result of poor muscle tone or connective tissue laxity. Okay, so we're now going to talk about treatment. Treatment will really vary according to the symptoms and severity, but certainly should focus on relieving the symptoms, improving functional capacity, spatial awareness, and joint stability, and just generally preventing complications in order to achieve independence with, minimum external support. So treatment options may involve pain medication, possibly braces or wheelchairs and other devices to assist with joint stability, physiotherapy to strengthen the muscles and help stabilize the joints. Massage therapy certainly may help, again, with strengthening the muscles and improving joint stability. Monitoring for, aortic root dilatation and osteopenia. So the aim of treatment is to treat any acute soft tissue lesions and injuries, to relieve pain with soft tissue work and gentle mobilization to support the joints and the tissues, to improve balance and coordination and improve the endurance and strength of those core muscles and joint stabilizing muscles. Also just educating individuals on how to manage daily activities and normal functioning, with minimal medication and support, and to promote an active lifestyle. Re-educating maybe about posture and gait to avoid, or correct abnormalities, to improve stamina and general fitness. And all of these, should be done while coordinating with professionals, whether it's occupational therapists, physiotherapists, school teachers, maybe school nurses, occupational health. It's important to sort of have a team of experts around you. So in terms of pain management, really rehabilitation is the best treatment due to, the pain resulting, from musculoskeletal issues, as opposed to, pain resulting from a pathology. So as the muscles strengthen and the joints stabilize, the pain will ease. But, it's important to realize this can be a slow process. So again, if you're looking at something like massage, it's not a one treatment fix. You'd be looking at a course of massage treatments. Hot or cold packs on joints, can often help with pain. TENS machines, as we've said, massage, trigger point therapy, myofascial release, relaxation techniques, if, there are sleeping issues, can really help. And just pacing during any physical activity, pacing yourself to avoid those disruptive flare-ups, that can happen if you overdo it. In terms of posture and motor control, core stability should be the primary focus in order to achieve, peripheral joint control. So controlling the arms and the legs. Maybe having an individual sort of posture re-education program, motor skill training. So this would involve things like exercises that focus on a specific movement to improve skill and precision, or specific isolated low-level skilled stabilization training to improve activation of those postural muscles, rather than non-isolated, functional exercise. And this will help to adapt those brain pathways in functional activities. But also, in terms of motor control, this should be as pain-free, as the pain stimulates the motor cortex, encouraging protective strategies. Quality over quantity to avoid any fatigue and pain, which will limit performance. And any sort of training should be goal orientated, and individual to, you and the activities that you do. In terms of muscle strengthening, recurring injury or postural issues, we know, leads to chronic pain, which leads to reduced activity, which leads to muscle weakness, which then worsens the problem. This is particularly common in, particularly those that have hEDS in the knees, where there tends to be also an imbalance with the gluteal muscles. Following, this pattern of exercises can improve joint stability, muscle control and strength, and help reduce risk of injury, in cases where there's ligament insufficiency. So we're talking static exercises while there is pain, then dynamic exercises, once the pain sort of subsides a bit, then resistance exercises, and then going on to weight-bearing exercises, for which, if need be, hydrotherapy can be used if the pain is, an issue. And then obviously, any exercises done in water will be, there's lower impact on the joints. So, in terms of external support, using aids and supports can cause dependency, which leads to muscle weakness. But in acute stages of injury, using a brace to support an unstable joint, to improve movement and posture, and consequently assist with, proprioception or spatial awareness and healing, is absolutely, acceptable. They can also make participation in sports and other activities possible. So, if it's a way of keeping you moving, then, it's a good thing. Gait rehabilitation. So, obviously your walking pattern will be affected by hypermobile joints and the resulting issues, with, proprioception, spatial awareness and motor control, muscle weakness and reduced stamina, and all of these things, then change the way that someone functions, causing overloading of muscles, pain and fatigue. So gait analysis can bring recognition of abnormalities in order to improve the posture. Things like flat feet are common in hypermobility and can change the gait. But, something simple like supportive footwear or, insoles with arch supports can reduce the impact through the foot and therefore reduce pain. In terms of balance and proprioception, sensory input during rehabilitation to combat the effects of skin laxity can be achieved by hands-on movement facilitation by therapists, wearing tight-fitting clothes, using tape during functional rehabilitation sessions. And these things will sort of help combat the effects of all that sort of loose, stretchy skin. Balance, proprioception, posture, pain and muscle strength all can be improved through closed chain weight bearing exercises, exercises with balance boards, so things like squats, bridging, maybe 4-point kneeling or standing on one leg. And also dynamic balance activities. So things, for example, like where you're using, a Swiss ball or, the gym balls. And also, it's important not to underestimate the need for psychological support. If someone's quality of life is seriously affected by pain and functional limitations, or looking at pain levels, sometimes our pain levels can be determined by the way we think. So if we can alter pain perception through coping strategies, then consequently stress and sleeping patterns can also be improved, which in turn just helps you further deal with, sort of this disorder on a daily basis. One of the things that I've been asked a few times about hypermobility and Ehlers Danlos is in terms of people are never quite sure what type of exercise they can and can't do. So I'm going to talk a little bit about that now. While exercise is, probably the best treatment for hEDS, again, each person will have different symptoms, different levels of functioning, different pain levels. So it's important to choose the right kind of exercise in order to avoid, further pain or injury. Many people with hEDS will lead a more sedentary lifestyle due to the muscle weakness and pain, but this will simply worsen the condition of the muscles and reduce functioning further. So, and if there is muscle weakness, you've got to be cautious and begin with a low impact exercise, because, moving too quickly can just encourage flare-ups and set you back further. So, The idea is really to find the balance between maintaining lifelong fitness through healthy physical activity in order to reduce the pain and improve muscle strength and joint stability, and high impact physical pursuits, which, as I've said, can result in a chronic pain cycle and further disability. So, okay, so types of exercise. Do swimming, aqua aerobics, running in deep water. These will all improve cardiovascular fitness in a way that is low impact on the joints. And again, these are things that will offer a full body workout. Tai Chi and Pilates will improve balance and core stability. Cycling offers aerobic exercise without too much stress on the joints. Elliptical training, again, allows cardiovascular exercise without high impact. So looking at treadmills, steppers, stationary bikes. Nordic pole walking is functional and improves proprioception and core stability. Free weights will strengthen those deep stabilizer muscles, which are particularly important in anyone with hEDS and are often forgotten. But again, just build up gradually. Don't kind of go wading in there onto a heavy weight before you're ready. But also, unlike machines, free weights allow the body to work on more than one axis, which is great. But also it is easier to make mistakes, so as I've said, progress slowly. Now, in terms of the exercises that are a bit of a maybe, we're looking at things like yoga. While joint hypermobility means that you are flexible, yoga can put you at higher risk of joint subluxation. Now, it can be done and improve balance, but it's really important to find an instructor who has knowledge of hypermobility and Ehlers-Danlos. And I would say if you are already prone to dislocations or subluxation, then yoga, not for you. Non-contact team sports. Now, it's still a little bit hit and miss with regards to football, tennis, volleyball, and sports like this. Because the effect of these sports, will really vary from one person to another, depending on how, the condition affects your body. So the best advice I can give is really, don't make your decision based on the opinion of, one sort of article that you read online. Talk to your doctor, talk to your physiotherapist or specialist, and get their advice, because they know you and your condition and how it affects you, probably better than anyone else. So, and also, just reflect back on your own life, your injuries, how you recovered, because Ehlers-Danlos manifests itself differently in every patient, and your experience might be totally different, than someone else's. So, it's got to be an individual thing. Okay, the absolute don'ts in terms of exercise: contact sports. So, again, to a certain extent, football, hockey, rugby, aggressive trampolining, which you may be doing yourself, but, that can, again, sort of increase the chance of dislocations and things. So, but anything that involves tackling, again, due to that increased risk of injury and difficulties in healing, don't do it. Competitive gymnastics or cheerleading, best avoided. Because if you're unsure whether your flexibility is due to stretching your muscles or stretching your tendons and ligaments that are already lax because of the Ehlers-Danlos, you're just kind of putting yourself at risk, really. Now, don't stop exercise because of mild to moderate pain, because although I usually say no pain, no gain, is not a theory to live by. Exercising with Ehlers-Danlos may hurt. That's just the nature of the condition. But obviously, the more you exercise, hopefully the more any pain levels will reduce. So in this case, it is good to push through some pain to strengthen the muscles and reduce chronic pain. However, it's important to know your limits, and if something really feels wrong or the pain is getting really bad, then it's time to stop. Now, some other things that you shouldn't do are sort of distance running. If you want to run, then use an elliptical treadmill, which will place less stress on the joints. And obviously things like, Olympic lifting and CrossFit, these are high intensity workouts that, all it's going to do is increase your risk of a flare-up and probably push you into a chronic pain cycle. So again, best avoided. Okay, so how does massage help benefit those with hEDS? Well, we know massage helps to relieve muscular tension and pain. And also to ease muscular exertion and fatigue. If you've had sort of been doing a lot of physical exertion, massage will ease those fatigue levels. It will also reduce muscle spasms, which can be caused by overuse from compensating for weakened ligaments and tendons. Obviously, there is an aspect of general relaxation there, which, will really help just that person to manage their condition a little bit more effectively, promote sleep and, but also in terms of sort of the effects of having sort of a lot of loose skin, massage can really help by improving the ability to distinguish between different sensations, and also sensitivity around scar sites, maybe if there's been previous injuries or dislocations, for example. Massage will help reduce any internal adhesions, and also work on any sort of external scar tissue, and really help to relieve any discomfort from skin hypersensitivity, and to improve, the person's proprioceptive awareness, their spatial awareness of the body by helping to retrain the nervous system. So, and then of course there's all the other usual benefits that anyone gets from massage. But, if you have Ehlers-Danlos and you are looking to have a course of massage, there are some precautions. I always say it, ensure that you see a therapist who is fully qualified and experienced in dealing with hEDS. For the first appointment, just limit it to one area so that you can assess the effects of the treatment. The massage should not be deep. So deep tissue or sports, not appropriate. Again, due to hypersensitivity and, sort of the possibility of injury due to those sort of lax tendons and ligaments. And ensure that you're with a therapist who listens to your feedback. It's also important to do strengthening exercises following massage and joint realignment, or the joint will be vulnerable and then the muscle spasms will just start up again. So, but if you take, these things into consideration, something like a Swedish massage will be great, and you should see some benefit. And hopefully, it will help you to be able to participate in those daily activities and just function a little bit more effectively. So that is really it on hypermobility and Ehlers Danlos Syndrome. As always, feel free to subscribe to my page. You'll be informed when other videos come out. Feel free to comment down below or ask me any questions through my Facebook or Instagram pages, and I will do my best to answer you. Or if I don't know the answer, I'll find someone that can. Yeah, for now, that's really it from me. So do take care, and I will see you next time. Bye.